Hey everyone, and welcome. Today, we're jumping into a topic that affects millions of people, but is still, pretty widely misunderstood. We're talking about ADHD, and we're going to break down what it is, how it actually shows up in day-to-day life, and what the paths to managing it look like, all based on expert guidelines from the NHS. So let me ask you this. Does the world sometimes just feel like it's operating on a totally different frequency? Have you ever had to reread the same page of a book over and over and the words just won't stick? Or maybe you've got this constant humming restlessness inside, like an engine that just refuses to switch off. If any of that sounds even a little bit familiar, either for you or for someone you care about, then you're in the right place. Okay, before we dive in, we have to get something really important out of the way. All the information we're about to cover is based on official NHS guidelines. It's here to help explain things, but it is absolutely not a substitute for professional medical advice. If you've got concerns about yourself or someone else, the best and really the only first step is to talk to your GP. All right, so here's what we've got on tap. First, we're going to cover the basics. What even is ADHD? Then, we'll get into recognizing the core symptoms. After that, we'll walk through the path to getting a diagnosis, which is actually pretty different for kids and adults. Then we'll get into the practical stuff, managing life with ADHD, and we'll wrap up by pointing you towards some great places for more support. All right, first things first. What are we actually talking about when we say ADHD? To really get it, we've got to build our understanding from the ground up, starting with a really clear definition. So, at its very core, attention deficit hyperactivity disorder, or ADHD, is a condition where the brain is just, well, it's wired differently. And this has nothing to do with being lazy or not being smart or a lack of discipline. It's a neurodevelopmental difference. Think of it like the brain's air traffic control system. The part that manages planning, organizing, focus, all that executive function stuff, is just operating on a different set of rules. And when that system works differently, it can make everyday life feel like a real uphill battle. So, the big question is, where does it come from? Well, the truth is we don't know the exact cause in every case, but the leading theory, with a ton of research behind it, points to genetics. ADHD very often runs in families, which tells us that inherited differences in brain structure and chemistry play a huge role. But it's also really important to separate that from other things that are linked to ADHD. These aren't necessarily causes, but they're risk factors. Things like being born very prematurely or having a brain injury can affect brain development. And we also see a big overlap with other conditions like epilepsy or being autistic. Okay, so we know what it is, but what does it actually look like in real life? The symptoms usually get sorted into two main buckets. And it's so important to understand both because one is often way more visible than the other, and most people with ADHD actually have a bit of both. Right, so think of this as the two sides of the same coin. Over on the left, you've got the inattentive symptoms. These are often quiet, internal struggles. We're not just talking about getting distracted by your phone. It's a constant battle to organize your thoughts or finish a project or remember where you put your keys for the 10th time this week. Then on the right, you have the hyperactive and impulsive side. This is the stuff people tend to notice more. In kids, it can be that classic can't stay in your seat, always fidgeting energy. But in adults, that physical restlessness can turn inward, becoming this intense inner chaos, along with things like talking a mile a minute or making big decisions on a whim. And this right here, this is so important. For decades, the poster child for ADHD was a hyperactive little boy. And because of that, women and girls have been missed time and time again. Why? Because they often show more of those inattentive symptoms we just talked about. In a classroom, the quiet girl who's daydreaming out the window is way less likely to get noticed than the boy who's bouncing off the walls. And that can lead to years of quiet struggle, thinking you're just lazy or spacey, without ever knowing there's a real neurological reason for it. It's also really important to know that ADHD rarely travels alone. I mean, think about it. Living in a world that isn't built for the way your brain works is exhausting. That constant effort can lead to things like anxiety and depression. There's also a significant overlap with other neurodevelopmental conditions. It's actually really common for someone with ADHD to also have something like dyslexia or to also be autistic. A good diagnosis will always look at this bigger picture. So what happens if this is all starting to sound a little too familiar? What's the next step? Well, that brings us to the path to diagnosis. And you need to know the journey looks pretty different depending on whether you're a child or an adult. The starting point is totally different. For kids and teens, the process nearly always kicks off at school. A teacher sees a child day in, day out, and they're in a great position to spot patterns and start a conversation with the school's Special Educational Needs Coordinator, or SENCO. But for adults, that school safety net is gone. The responsibility falls on you to realize, hey, this is really affecting my job or my relationships, and then take that huge step of making an appointment with your GP. Once that referral is made for a child, the assessment is really thorough. A specialist will sit down and talk with both the parents and the child. They'll ask about everything: symptoms, family life, how the child has developed since they were a baby. And crucially, they'll connect with the school to get their observations too. It's all about building a full 360-degree picture of the child. They might also use special rating scales or computer-based tests to get more objective data. Now, for adults, the process has a different flavor. It's much more of a look back in time. See, because ADHD is a lifelong neurodevelopmental condition, the symptoms have to have been there in childhood. So the specialist will ask you to think back. What were your school reports like? Were you always in trouble for daydreaming? They'll connect that past to your present and see how it's affecting your life now. And they might even ask to talk to a parent or a partner, someone who's known you for a long time, to get another perspective. Okay, now for a quick dose of reality. Taking that first step to get help is massive, but unfortunately, getting an assessment on the NHS can involve a really, really long wait. We're talking many months, sometimes even years, depending on where you are. It can be incredibly frustrating. But if you live in England, you should know about something called the Right to Choose scheme. This lets you ask your GP to refer you to a private provider that has an NHS contract, which can sometimes cut that waiting time down significantly. So once there's a diagnosis, the focus shifts from what is this to how do I manage this? And the cool thing is, even though the diagnosis paths are different, the strategies for managing ADHD are built on the same core pillars, whether you're 8 or 48. It's all about creating a supportive ecosystem for your brain to thrive. First up, and this is the foundation for everything else, is lifestyle. Regular exercise isn't just good for your body, it's amazing for an ADHD brain. It can actually boost the chemicals that help with focus. Sleep is another big one. It's totally non-negotiable. It can be tough when your mind is racing, but a solid, consistent bedtime routine is key. And of course, a healthy diet helps keep your blood sugar stable, which prevents those energy crashes that can kill your concentration. Next, it's about tweaking the environment to work with your brain, not against it. For a kid in school, that could mean breaking down a big assignment into small 20-minute chunks. For an adult at work, you actually have a right to ask for what are called reasonable adjustments. This isn't about getting special treatment. It's about leveling the playing field. It could be something as simple as getting a desk in a quieter spot or asking for instructions in writing instead of just verbally. The third pillar is about medical and therapeutic support. Now, for a lot of people, medication prescribed by a specialist can be an absolute game changer. But it's also really important to know that it's not for everyone, and it's not the only option. Talking therapies like cognitive behavioral therapy or CBT can be incredibly helpful. CBT for ADHD gives you practical, real-world strategies for things like procrastination, time management, and handling big emotions. And look, getting a diagnosis can be a lot to take in. It can be overwhelming, but the most important thing to hear is this: you are not on your own. Which brings us to our final and maybe most crucial section: where to find support, because connection and community are everything. Here are just a few of the fantastic organizations out there. Charities like ADHD UK and ADHD Adult UK are packed with reliable information and can hook you up with support groups. For younger people and their parents, Young Minds is a brilliant resource for mental health support. AAD UK is great for finding local groups where you can connect with people who just get it. And because we know mental health can be a challenge, remember that organizations like the Samaritans are always there to listen, no matter what. And that brings us to a final, really powerful idea. It's this concept called neurodiversity. The simple but profound idea that brain differences like ADHD aren't flaws. They're just a natural and valuable part of human variation. Yes, they come with huge challenges, but they can also come with incredible strengths, things like creativity, out-of-the-box thinking, and an amazing ability to hyper-focus on things you're passionate about. So I want to leave you with this thought. What could it mean for you or for the people in your life if we started to reframe ADHD not as a deficit, but just as a difference?